As President of the University of Limerick, it gives me great pleasure to welcome you all to the formal opening of the Graduate Entry Medical School building. GEMS offers a medical degree programme which is open to graduates from any discipline and is strongly supported by Access scholarships. Through innovative teaching practices and the application of a problem-based learning approach, GEMS has proven its ability to graduate doctors who understand the scientific basis of medicine, recognise the social and environmental contexts in which health and illness exist, and are strongly committed to service to the public. And today I want to take this opportunity to pay tribute to those who worked on the campaign to establish GEMS at UL. It was my honour to work on this cause with President Emeritus John O'Connor and the founding head of GEMS, Professor Paul Finucane, both of whom I'm glad to see are here with us today. With their hard work and inspiration, and with the support of Professors Declan Lyons and Pierce Grace and others in the medical and UL communities, colleagues who were willing to work against all odds, UL was able to break the mould of medical education in Ireland. This medical school venture typifies in many ways the UL spirit. We identified a strategic national need. We recruited the brightest and the best to find the right solution in collaboration with best practice partners from right around the world. We proposed innovative solutions to government, and we competed fairly and at times fiercely with our peers to win state support. And then, when we were approved to create the largest graduate entry medical program in the country, we moved swiftly to execute our plans and deliver benefits to the communities we serve. This is the UL way. Our students divide their time between their learning on the UL campus and clinical training activities in a number of hospitals in the region and beyond, and also at more than 120 general practices across Ireland, with community-based primary care education being a particular emphasis of our course. Today, I would like to thank most sincerely our many partners for their ongoing support and for their absolutely vital contribution to our students' learning.
Change is the greatest dynamic ever in any country, and we should never be afraid of change, and we have applied a lot of change to Limerick City and County and the wider region, from the local authorities to Shannon Airport to bringing in the IDA and so on in the last couple of months, certainly over the last 3 years. If you take the combination of very expert people with the concept of lifelong learning, using the most advanced technology to solve the solutions that we all want solved in terms of our personal health, that's where medicine is going. And I think it's very important that this university here, which is renowned nationally and quickly establishing an international reputation, would be at the forefront of that through this college here. So for lots of reasons, I'm delighted to be here this morning. And I'd like to thank the authorities of the college again, and Professor Don Barry and all the people on the medical, all the staff here of the medical college for honouring me, as I said already, by inviting me to participate here this morning in the official opening of this building. Thank you very much indeed.
The University of Limerick is now firmly established as a powerhouse of innovation. At hospital level, during the past 3 years, under the effective and energetic guidance of our Chief Executive, 6 disparate hospitals have been transformed into a coherent university hospital group. It is our intention not just to consolidate or strengthen the links between the university and the hospital, but to embed the principles of excellence and scholarship of the university into the very warp and weft of the hospital system. It is also our ambition to have the hospitals perceived not just places where you go when you're ill or injured, but as a resource and a source of pride to the people of the region that we serve. Having a public health role of high standing, a powerful educational function, being friendly places of high quality, where the patient is the focus of all endeavour, and that the spirit of competence, kindness, safety and honesty and inquiry will be reflected in all that we do. The recently established strategic plan of our hospital group sets out an ambitious programme of development. Much has been achieved during the past 2.5 years. Much more is required. But if given strong support of the community, continuing help from our public representatives, assistance from the media, all these ambitions can be realised, as exemplified today by the spectacular milestone that we celebrate here on this most honourable site. Thank you.
The crowning glory of my training was graduating 2 weeks ago. All the highs, all the lows, all the energy expended over the 4 years was returned to me 100-fold. Succeeding in the course has been the best thing that has ever happened to me and has changed my life irrevocably. I'm just so proud to be a graduate of this amazing school here in UL. And I am forever grateful to my wonderful clinical and academic tutors and the endlessly supportive administrative staff who did everything they could to help me fulfill the dream of my 5-year-old self. Thank you very much.
So I'd like to end by thanking and commending all of the people of the GEMS for the hard work they do in this building and beyond. But in turn, I'd like all of the GEMS people here to thank all of our visitors today for their support in UL's journey to accommodate a modern School of Medicine. Thank you all. Gaurav Mahagat.